Maternal injuries are injuries that occur to a mother during pregnancy or childbirth. Childbirth can be a very frightening experience for expectant mothers. Some injuries can occur to a mother in childbirth through no fault of the doctors or midwives caring for them. However, there are some rare situations where mothers are injured during childbirth because the doctors and/or the midwives taking care of them failed to carry out appropriate investigations or failed to take steps to ensure the mother was properly protected from the risk of injury during childbirth. And it's those situations that can lead to medical negligence cases. I've dealt with a number of cases concerning mothers who have suffered maternal injuries due to hospital's negligence. Some cases arise where mothers have suffered a perineal tear. In one such case, I represented a mother who was known to the doctors and midwives to be having a big baby. During the course of the labour, she required assistance to deliver the baby with forceps. Unfortunately, the doctors failed to control delivery of the baby's head and failed to carry out an episiotomy, causing the mother to suffer a 4th-degree tear. She was left with incontinence and ongoing pain and required further surgery to correct the incontinence. However, there was still a risk that that incontinence could return as she got older. In another case, a mother suffered a perineal tear following childbirth. And whilst that tear didn't occur because of the hospital's negligence, they failed to notice the tear and to repair it immediately. When they don't repair a tear immediately, the prognosis of any repair is a lot poorer. In another case, I represented a mother who had a retained placenta. It's very important when a baby is born, the doctors and midwives ensure all of the placenta is delivered. If it's not, then there's a risk of infection to the mother. In the mother that I was representing, she suffered an infection due to retained placenta and then suffered a postpartum hemorrhage. The postpartum hemorrhage was also poorly managed and she had a hysterectomy unnecessarily. You can never underestimate the psychological impact of these types of cases. Whilst the mothers are having to cope with the physical injury, they're also having to cope with the impact that's had on the physical relationship, their self-esteem and body image. Sadly, I've also been instructed in cases concerning stillbirth. In 2 of those cases, we were able to establish that there was a failure on the part of the midwives to note that the baby's growth had fallen off towards the end of the pregnancy. Had it been noted, then those babies would have been delivered by caesarean section alive and well. Unfortunately, those mothers had to endure the childbirth knowing that their babies had passed away. And they had to endure the pain of the childbirth, the grief reaction, and in addition suffered a psychological injury. Cases concerning maternal injuries are often very complex. It's important to have a solicitor who is experienced in dealing with these cases so that they can recognise any arguments the defendant might raise and can advise you when your case should be fought. As I've mentioned, I don't think you can ever underestimate the psychological impact of these injuries on mothers. We normally find that clients find it difficult to talk about their injuries. They often feel embarrassed having to talk about such personal issues and often have other commitments at home, like a newborn whom they're having to care for. In my experience, a mother who has suffered a maternal injury needs someone to help take the pressure off them. We do this as much as we possibly can for our clients. We are happy to travel to meet with clients at their home, as we appreciate it may be difficult for them to travel to us, and they may find it easier to talk about what has happened to them within the comfort of their own home. One of my clients recently moved to Brazil whilst pursuing her claim. We managed to find ongoing ways to communicate regularly via Skype to ensure she was kept fully up to date with developments in her case, and we were still able to secure a good settlement for her. We're committed to getting the best possible outcome for you, and in the process of doing so, we understand the difficulties you are experiencing through no fault of your own, and will endeavour to do all we can to ease the pressure on that situation while securing the best possible outcome.